Hello, and thank you for taking the time to watch my presentation on the Family Health Model, a review of Denham's 2003 model. My name is Derek Griffith, and this presentation is for Nursing 714, Summer 2022. In this presentation, we'll be taking a look at theory description and key features, definition of key concepts, theory application and practice, and a discussion of relevant research. In relation to the theory description, Denham's family health model focuses on pedigree, so genetics and where you come from, what makes up the habits that culminate your life and your experiences, the social influence of those around you, whether it be your neighborhood, your schoolmates, your workmates, anyone that has an influence on your day-to-day activities, the environment and how it plays a role on you, your access to resources, inner city, upper class, and spirituality, how church and religion fall into each of those. Each of these is a culmination of inputs that relate to each member of the family as a unit. So each aspect or domain combines to create the atmosphere in which family health develops. This is referred to as a family health routine. Family health routines are structured activities that each member of the family participates in. These recurrent patterns impact the health and well-being of all members in a household. Here's some of those health routines on a breakout. Health routines tend to be complex interactions. Specifically in this case, we take a look at those complex interactions as they relate to the household members themselves. All members of the family participate in these healthcare routines, and these are often a gauge for us to assess the ability of a family to handle stressful situations and manage those health crises. These are taught in the home, and they can strengthen outcomes during a health crisis. This could be anything from a child with a chronic illness, mental disabilities, an elderly parent with onset dementia, or deteriorating health and lifestyles. And you can see here in the chart to the left just some of the routines and inputs and how those have an effect on individual families. Anything from daily routines that can increase positive discipline, increase parent-child activities, or in some cases decrease them, how nurturing plays a role in the home, and enriched environments, co-parenting as opposed to single parenting, divorce, separations, parent alliances, so not divided. All of these play into the family's health and the ability of individuals to accomplish successful tasks and manage crises. So a few of the key definitions we're going to take a look at here are family, the centralized hub from which an individual interacts, the centralized hub being the home where an individual is taught and developed and then goes out to interact with those in society. So family being that central hub of action encompasses the essential context for development. This includes all family members across time and setting. Family functions as the basic unit of health on an individual level, leading to societal levels of change in healthcare practices. So this essentially discusses, as we'll get into a little bit more later, the micro levels of interaction affecting the community at whole as a macro level exchange. Health, as defined by the family health model, is an adaptive state experienced by family members as they seek to optimize their well-being. And this is often considered the state of wrestling with liabilities found within the self, the family, the household, and various environments where they interact throughout the life course. So it's a progressive and continual experience that creates the family health. The environment is simply any sphere of interaction that the individual has. This can be school, workplace, community, church, monetary resources, community resources, community demographics, political milieu, social environment. All of those play a role in family health. As nursing interactions through this model, we'll cover this pretty in depth in the next couple slides, but the nurses action is to assess, plan, act, and evaluate through providing care on an individual level to the family members, often finding ways to treat the family as a whole instead of individual units. And this is done through the 3 domains as defined by Denham: the contextual, which involves the socioeconomic status and social support; the functional, encompassing relationships and interactions; and the structural, that covers family routines. So here in the application of theory, we'll take a look at an article that discusses family-focused public health. This was specifically during COVID-19. But their biggest takeaways and areas of application for this model focuses on the family in the 4 areas of mental health, family planning, life expectancy, and child development. So in specific relation to the life expectancy, it was identified that life expectancy is in a downward trend as accidental deaths continue to rise. A lot of this is associated to mental health, and we see the opportunity to strengthen communities, starting at the micro level, as we discussed a little bit earlier, meaning directly in the home. So these health problems are often viewed from a multi-dimensional perspective, assessing the 3 different levels of need: the primary, secondary, and tertiary, as it affects the individual, community, society, state, and gets larger and larger in focus. So the systems need to be tailored to the specific needs of an individual. And some extra planning points for this, especially in relation to kind of the child development, the life expectancy, just dealing with those potential stressors as they come about. And a few good resources for that are the Healthy People 2020 initiative, which seeks to create social and physical environments that promote good health for all. And this focuses on the individual health promotion throughout the lifespan. Essentially, it seeks to establish early health routines. Another good resource is the Public Health 3.0, which seeks to focus on social determinants of health to create lasting improvements for the health of everyone in America. And so one other good local resource is the 211 hotline that, as a nurse, allows you to put patients in touch with community resources through the hotline, whether it's housing or assistance with food, assistance with rent. Any of those can be accessed through the 211 hotline. Here we have a chance to take a look at a research article that kind of discusses the health beginning at home aspect of family health model. And so this focuses on ways to assist as a practitioner the family and their development. So specifically, it takes a look at these 4 domains: family responsibility, family stability, family diversity, and family engagement. Family engagement involves families in planning with respect to their autonomy and culture, and ultimately respecting their decisions to treat the family as a unit and connect family with those community resources. The responsibilities include family planning, partner relationships, monetary support, and child rearing. Family stability is helping to create balance in family functions related to health and avoiding chronic health conditions before they become a problem. Family diversity includes accepting families for who they are, as each is an unique structure and culture with religious and economic situations that present their own special needs. And lastly, we'll take a look at the family health scale, a reliability and validity of a short and long-term form. This project was seeking to create quantitative information that can be put together to identify families' needs. So family relationships are some of the 6 criteria looked at, were family relationships, family social context, family member health, family health-related practices, family health resources, and management of time and activities. Those are the 6 domains that built upon Denham's 3 domains. So the family health scale consisted of short and long-term forms. The short form was 12 questions and the long form was 40 questions, and this helped to culminate that quantitative data and assess families' needs. They performed 3 studies consisting of 1,500 participants, and the results did show a strong statistical correlation for positive identifiers. And one other article we'll take a look at real quick as family health model in practice is the family and social variables associated with family health. Here they were taking a look at an assessment for relationships between family situations and social factors related to health, identifying the bell curve findings that supported the middle class as holistically balanced and healthy, while you see on both ends of the extreme poverty and wealth led to increased stress and reduced health. This could be offset by larger social support networks, and this study consisted of 432 families participating in the study with an average of 3.2 people. This is my reference list. Thank you for listening.